Complex regional pain syndrome originating from the back region is an extremely rare event. This video illustrates how to make the diagnosis of complex regional pain syndrome of the back. Often, these patients do not recognize spreading of complex regional pain syndrome from the back to other regions of the body. This is the first in a series of high-definition educational videos being offered by the International Research Foundation for RSD CRPS that are available for playback on computers and on all mobile devices.
All right, let's see here. So today is October 10, 2011. You're here from Texas. And Hannah, the first thing I want to do is kind of go over your history just a little bit, okay? Back in June 2011, you had a spinal tap done, or spinal puncture done. Anyway, make a long story short, as a result of that, it appears as though you developed some RSD in your back. We've seen this before. You're not the first one to have that happen, but it's not the most common scenario, as you've kind of learned by now, right? Okay. Usually people talk about limb injury, or that sort of thing, but you, it's more what we call a truncal type injury. Anyway, to make a long story short, you over the months you started getting spreading over to that left shoulder of yours, and now by my testing with your pain thresholds and so forth, and your own testing, we now think you've got it going into the left side of your face, and also we have it going into that left leg of yours down there. Okay, and so there's no question the whole left side of your body, in my mind, is completely involved with the disease. Okay. Now, and so you're a very good candidate for the 3-day ketamine treatment. Now, we talked about why it works, and the studies we've done to prove that it works and all that. Did you have any questions about that part of it? Anybody? Okay, excellent. Now, the first thing we want to do here is we want to establish a very solid baseline. We just did your pain thresholds. Now we're going to do functional testing on you. You ready for that? Yes. Okay, the first thing I want you to do is it's called the vertical finger test. Look straight ahead. Don't watch me. I'm going to come over from your side, put 2 vertical fingers in your mouth, and I'm going to ask you if you have pain when you do that.
No.
Okay, very good, excellent. Next thing I want you to do is I want you to take that right hand, put it behind your head, please. That a girl, are you having any pain when you do that?
No.
Take that left hand behind your head. And you're having some issues there, aren't you?
Yeah, it's a little stiff.
A little stiff, kind of maybe a little soreness, would you say?
Yeah.
Yeah, okay, and that's what we would expect with that RSD in the shoulder area, isn't it?
Yes.
Okay, the next thing I want you to do is take that right hand out in front of you and make sure you involve your thumb. Open and close your hand as best you can. That a girl. Good. Do the same thing with your left. You're a little bit more hesitant there, aren't you?
Yeah.
Okay, very good. Now the next thing we want to do here is we want to have you stand up. Your mom's going to help me out here, okay? We mapped you out earlier where you have these areas of allodynia, okay? That a girl. And we'll just tuck this underneath your bra there. There you go. Good. Now, Mom, just for the record here, I want you to start over here. She can't see you. Come over here. Tell your mom to stop when she gets into that raw area like road burn, okay?
Yes. Stop.
So you see, it's very reproducible. You see you see? It's what we call highly demarcated. Mm-hmm. One more time. Okay, start up there. She's coming down again. Tell her to stop when she gets into it.
Stop.
Yeah. So you can't, your point discrimination back here, you don't know where those lines are, but we can see them back here, okay?
Yes.
So I'm just going to use my camera here to map out exactly where we're talking about here. And on up this way and also down this way. And as you can see, you're more extensively involved with the disease on your left side, okay? And so that's why you're having more symptoms on that side of your body, generally speaking. Okay, please sit down, Hannah, and make yourself comfortable. Now we're going to turn our attention down to your legs, and I want you to take that right ankle and I want you to rotate it for me. Atta girl. Good, good, good. Wiggle your toes, please. Atta girl. Hitchhike back to Texas. Oh, well, look at that. You might make it. All right. Over here, rotate your ankle. A little bit more stiff, huh?
Yeah.
Wiggle your toes, please. Okay. Hitchhike back to Texas. Yeah, you're going to get there. All right. Double toe, hitchhiker. Okay. Now what I want you to do is get up in front of that door there, please. Okay, now stand there for a second. Now I'm going to ask you to take 3 steps forward, Hannah, and 3 steps back. And then when you get back, I want you to tell me if you're having pain. And if so, I want you to point to where your pain is. You ready?
Okay.
3 steps forward. 1, 2, 3. Yep, and back. And I see you're very wide gait, so you're really a little unsteady, aren't you?
Yes.
And is that due to pain? And if so, where's the pain?
In my back, like a little.
Right in there. And that's why you kind of got a wide base when you walk, so you don't fall, right?
Mm-hmm.
I'm going to ask your mom, for safety reasons, stand by your side, okay? She's there if you need her. And now I'm going to ask you to take 3 steps on your toes, please. Atta girl. 1, 2, 3. One more. Take 1 more. Forward. Atta girl. And go on back, please. Atta girl. Good job, Hannah. Good job. Good job. That's really tough on you, isn't it? If your mom wasn't there, you might fall, right?
Yeah.
Yeah. It's very tough. And again, do you have pain in your legs, or is it more in that low back area?
In my back.
In the low back area? Right. Now, I'm going to have you take 3 steps on your heels, and I'm going to ask you, is it worse on your heels, on your back, or is it on your toes, okay?
Okay.
Here we go. Go ahead. 1, 2, 3. Okay, very good, Hannah. Go on back, please. Atta girl. Good job, Hannah. Good job. Now, was that worse than on your toes? It was? Okay, and again, the same area in your back, correct? Okay, you can sit down. Okay, your mom's seen the 12-minute video. Did you have any questions about that?
No.
Okay, pretty straightforward. And you're a nurse.
Yeah.
Holy smoke, you got a private nurse. I mean, how lucky can you get, huh?
Yeah.
Okay. Now, the only thing I'm just gonna ask you, Hannah. Do you have any questions at all about what we're gonna do here?
No.
Pretty well got it mapped out in your head. Okay, very good. Well, I think we're ready to do some. Oh, one other thing. I'm so sorry. I knew there was one other thing I need to do, and it's kind of important. I need to put a face on this pre-treatment thing, and so I'm going to turn to your mom over here. Mom, why don't you tell us about how her life was before June 2011? Was she a very active girl?
Very active, living independently at college in Austin. We live in Dallas, so that's several hundred miles away. She's a competitive equestrian, jumps horses, has her own horse, and snowboards, just very, very active.
Right. So this has made a big dent in her life.
This has literally derailed the whole of Hannah's life. She can't even manage online college courses at home.
Right, it's hard to concentrate.
Mm-hmm.
Yeah, that makes sense, yeah. Okay, it's the 14th of October 2011, and you've been on 200 milligrams of ketamine an hour, which is what do we call people like you?
Expensive date.
God dang, you're smart. Jesus. Now let me see something. Look, open your mouth. Let me see that tongue of yours. Oh my God, look at that. Isn't that disgusting? Look at that. Oh my God. Listen, Mom, come on up here. Mom's going to ask you a couple of questions, okay? And by the way, we're just about 4 more minutes from completing this. So, Mom, ask her 2 questions, see if she can get them right.
What's your favourite animal?
Cow.
Correct. And what's your dad's name?
Andrew.
Correct.
Okay, now Karen, come on over here. Karen's got a couple questions for you.
All right. Can I ask you a question?
Yep.
What is my mother's name?
What's your mother's name? How am I
Just kidding.
supposed to know what?
Come on, Karen, you don't do that.
Just kidding. Okay. I noticed that Dr. Kirkpatrick has a fly in his pocket. All right. Can I ask you a question?
Yes.
What did I notice about Dr. Kirkpatrick?
We have flies pocket.
He what?
We have flies pocket.
Fly in his
I got to find pocket. Okay, that's right. And well, we want to hear your voice, so that's why I asked you to repeat it. Okay, Karen, ask her another one now about something you noticed about her mother.
Okay. I noticed that your mother has a golden tiara on her head. Can I ask you a question?
My mother has a gold tiara.
Well, she said, go ahead and ask. She's asking if she can ask you a question. Can Karen ask you a question?
Yes.
Okay, go ahead, Karen.
What did I notice about your mother?
She has a golden tiara on her head.
Very good. Excellent. Okay, a couple more things here, and then we're going to stop picking on you. Turn over here. Look at this handsome guy over here. You know who I'm talking about. Okay, turn your head a little bit more toward me. Turn that, a girl. Good job. Now I want you to look at my finger. Follow my finger. Look up there. Look up above your head. Look up there. Go on. Look up there. Look up there. Up. That, a girl. Now look over here toward me. Are you seeing over here? Look at my finger over here. You see my finger up here? Look up here. Look up here.
Oh.
Hannah, up. See it up there? That's good. So we're documenting the nystagmus in your eyes, okay?
That's B.
Yeah, nystagmus. That's a technical term, okay? So anyway, I got one more question for you, okay? You ready?
Okay.
Are you ready? All right, show me the sign. All right, very good. Good job. All right, so what I'm seeing here, just so for the record here, I'm seeing she preserves a lot of cognitive function. at relatively high doses. And she's correct. She's very correct. She is a very expensive date. That's right. You are. So today is October 17th, 2011. You trying to steal my lines? And listen, you went through the 4-day ketamine infusion, okay? That means your last infusion was on Friday, so now we're looking at you some 48 hours plus since you had last infusion, okay?
Yep.
So you had the whole weekend to test out, do a test drive on that new body of yours, all right? So now, we just did your pain thresholds. We noted some significant improvements there, okay? And especially on your left side, am I correct?
Yes.
Yeah, left, okay. And what we're going to do now is we're going to do some functional testing on you, okay? See if that correlates. First thing I want you to do here is I want you to do the vertical finger test. Look straight ahead, don't follow me, please. There you go. Any pain when you do that?
No.
You didn't have any pain when you started, you don't have any now. Okay. Next thing I want you to do is, you're sitting straight, that's good. Take your right hand, put it behind your head, atta girl. All right, you have any pain when you do that?
No.
You didn't have any pain. Well, you did have a little
Not on this side.
Not on this side. It was only on the left side, yeah.
Yeah.
Put your, yeah. Do you still have that pain or is it different?
No, it's just like mild. I can feel
Mild
it, but
Nothing like it was
painful.
before. Okay, all right. Next thing I want you to do is take that right hand out in front of you, open and close as fast as you can. Okay, now do the same with your left. Yeah, a lot faster there, aren't you?
Yeah.
Yeah, okay, good. Now, the next thing I want you to do here is I want you to stand up, please, and I want Mom to help me here. Can you just hold that up? Just there we go. Okay, now this mark we have here, the solid line, is where we started with you on your allodynia, okay? And you see this little kind of wiggly line, or broken line, that's where we are now. So it has shrunk over on this side, okay? Over here, it's a similar story. You started at the solid line over here, and now it's shrunk down, and you can see it's shrunk down over here, okay? Which means that you couldn't really sleep on your back before, right? But now you can sleep on your back, right? And that's obviously that's very important. And you can wear loose clothing, whereas before you couldn't because a breeze or anything lightly touching your skin would be very annoying. Am I correct on that?
Yes.
All right. Okay. Now, next thing I want you to do here, Hannah, I want you to go ahead and sit down, please. And by the way, all that stuff going on in your back, and just so everybody can, we remind everybody, this is due to an LP puncture, you know, a spinal tap, basically.
Yep.
And that's what set off this whole allodynia, the RSD in your back, which is not the most common. We all agree, not the most common way of expressing RSD, right?
Yeah.
But after doing our pain thresholds on, we came to realize you have it all the way up and down your whole side, left side of your body, including your leg. Okay?
Yep.
Now, next thing we want to do here is we want to go down to your feet. I want you to take your right foot off the ground. We'll rotate your ankle. That girl, wiggle your toes. All right, very good. And hitchhike on back to Texas. Okay, very good. Over here, do the same thing. Rotate, wiggle your toes. Hitchhike back to Texas. There you go. Good girl. Now we're going to do the more challenging thing. So I'm going to ask your mom to stand by your side just for safety reasons, okay? And we're going to have you take 3 steps forward, please. Right? And 3 steps back, please. Now, in the pre-treatment video shows that you got a wide stance because you had trouble keeping your gait, didn't you?
Yeah.
Do you feel like you're more in control of your walking now?
Yeah.
Did you have any pain when you do that?
Just like a little bit of discomfort.
Just a little bit of discomfort in your back?
Low back.
And didn't we talk about that maybe just being out of shape because you haven't been exercising? It's not your fault, you just couldn't.
Yeah.
And so I expect a lot of that low back pain to disappear with the heated pull exercise we're going to talk about here in a little bit.
Yep.
Next thing I want you to do here, Hannah, is I want you to take 3 steps on your toes forward and 3 steps back. Something you really couldn't do very effectively before by yourself. There you go, going back, and you had to use your mom, didn't you?
Yeah.
Okay, you feel more in control now?
Mm-hmm.
Okay, do your heels now too, please. Okay, there you go, and heels back. Again, you couldn't do that safely before, but you can do it now. Okay, very good. Go ahead and have a seat, please. Now, I think what we're going to do here is we're going to go ahead, and by the way, you realize that your ability to ambulate correlates with your pain threshold improvements over here, right?
Mm-hmm.
Okay. Now what we're going to do is going to talk about the treatment plan, okay?
Yep.
All right. Now, this means heated pull exercises. 3 days a week if you can handle it. Probably no more than 30 minutes each time, okay?
Yeah.
And if the water's cold when you get in, that's okay, but if it's still cold after 3 minutes, you have to get out. You can't let your muscles get chilled down, okay? Now, there were 4 reasons I gave you, I know you're very smart. You could probably just tell me without me reiterating it. But anyway, there were 4 reasons why we said the heated pull exercises are important. Number 1, you're not ready for full weight bearing on those legs right now. You're not. So buoyancy is one factor. The another factor is that you still have some allodynia in your back. The water is a potent desensitizer. It will desensitize you further than what you are right now. Okay? Now, the other thing is that you don't want to re-injure yourself, because that's the most common reason for relapse, isn't it?
Yes.
So water is probably one of the safest things you can do as far as exercise without re-injury. Okay?
Yep.
And finally, as you've learned over the past 4 months or so with this disease, is that stress can aggravate it. And water can be a very profound stress reliever. We talked about a technique called Watsu, which you need a partner to do. And you need someone to teach you. They have certified Watsu instructors. I'm sure they got one probably in Dallas or someplace like that. You need about 3 lessons to learn how to do it on yourself. Or you can just, when you get to the water, just find a quiet place to do your water exercises. No kids yelling, screaming, squirting guns, none of that stuff, okay?
Yeah.
All right. Now, we said that the heated pull exercises can serve a very important tool in engaging whether you need another ketamine infusion, didn't we?
Yes.
We said that it affords you an opportunity to measure your exercise tolerance, okay? All right. Now, so if you, let's say you get in the water and your workout is 5 minutes, okay? And that's it for the day. And you get out of the water and the next week it's 7 minutes. You don't have to feel anxious about having another ketamine infusion, because you're improving in your exercise tolerance, right?
Right.
Now, if you get out of the water, at 7 minutes, 5 minutes, doesn't matter, you have no pain, is that good or bad?
Bad.
Why?
Because you haven't done enough.
That's right. Every athlete will tell you they have to get good hangovers in order to make real progress and getting back in shape, getting in condition, right?
Yes.
On the other hand, if you get out of the water and you're laid up in bed for a day or 2 or that sort of thing, that's called a what?
Bad hangover.
That's right. Bad hangover. That's right. So you're going to be shooting for good hangovers. And if you're in the water and you feel pain, as long as you're not injuring yourself, with, banging into things and what have you, then that's okay too, isn't it?
Yep.
Okay. Now, so the heated pool exercises serve a very important point. Now, I'm gonna do what's ambush your mother over here with a test question. Okay? Yeah, you're a nurse, aren't you?
Yeah, technically.
Yeah, technically. Don't.
Just
Okay.
covering myself.
She's been off the job a while.
Oh, for a little while.
Yeah, just one patient here. She's
Yeah,
a full-time
right,
job.
right. Okay, there's one word that you should never use. You're a caregiver, right? It's a 4-letter word.
Yeah,
What's
the
that
P
word?
word.
The P word. What is that?
The pain word.
The pain word, right. But you can use the FU word, right?
Yeah,
What's that word?
function.
That's right. Function, right. And because when she goes to work out, you don't say, well, how's your pain today? No. How long did you exercise? How long did you go? That sort of thing. So that's very important to get her to focus, because, pain is a very confusing thing for patients that have CRPS. Wouldn't you agree with me?
Yes.
You're a smart girl. You know that, right?
Yes.
Okay, well, finally, the last thing we want to talk about here in terms of a treatment plan is you're on fentanyl, okay?
Yep.
And we want to get you off of that. We talked about how you can safely go off the opioid by halving the dose on a weekly basis. Now, since fentanyl comes in a patch, you probably want to convert that to what we call morphine equivalents in pill form. It's easier to wean yourself, halving the dose on a weekly basis if you're taking pills, as opposed to trying to manipulate patches, okay?
Yep.
And you can work that out with your local pharmacist, that sort of thing, okay?
Yes.
Now, I'm going to turn over here to your mom, because your mom was commenting on some things she's noticed about you. And why don't we start with her appearance, her face?
Yeah, definitely a whole body, particularly a face, is a lot less swollen in just a very short amount of time.
Right. And that's a very common scenario. And you know what? The patients don't even realize that. They don't even know it, because they're looking at themselves every day. And you probably didn't realize it.
I think a father will be the interesting judge who hasn't seen her while we've done the treatment. Right. So that's something that we see very commonly, and that's why we take medical photographs of the face before and after. Did you notice anything else different? Less of those kind of clonic
Jerking.
jerkings, muscle spasms.
Right. Right, right. Again, that's how you treat those, is you treat the RSD,
Yeah,
right?
and just better mobility. Her legs are closer together, and a stance is wider when a stance is closer together, and a stride is longer, and
Right.
she's got the ability to walk backwards, which she didn't have before. Just
Right.
the mobility is very much more improved.
Right, and so she's able to sleep on her back for the first time. So that's important because, you know, she has to feel comfortable in sleeping, because if you don't get good sleep, you wake up kind of restless. Okay.
Yep.
How about you, Hannah? Did you want to comment on how the experience was for you?
It was good.
I mean, you're not a cheap date. You know that. It takes a
Yeah.
lot to knock you out. Was it worth it?
Yeah, definitely.
Quite an experience, isn't it?
Yeah.
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 Now you know why they call it tripping, right?
Yeah. Definitely.
Very good. Well, I expect you to do very well. Okay.
Yes.
And okay, very good. Anybody else have any questions at all? Anyone?
Nope.
Okay. Yeah, we were just talking here, Hannah, about that this has been something that we can share with other people because it's educational.
Yep.
And the two things I think in particular is that your presentation is a little unusual. It's in your back. That's not, as you know from your own research, that's not a very common presentation.
Yes.
And when it's in your back, it can affect your ability to walk, wear clothing, sleep, and all that kind of thing. The second part of it is you didn't even know you had it spreading down into your leg and into your face until we actually did these measurements on you, right?
Yes.
So another thing is, unless the doctor really does a careful examination, they don't appreciate that this is a disease that can be widespread. And in your particular case, practically the whole left side of your body, okay?
Yes.
So those are some educational points that I think are important. Now, I just want to make sure it's okay with you if we put this up for other people to learn from. Is that all right?
Definitely.
Okay. And also I have to ask your mom. Is that okay with you?
Yes.
Okay, very good.